We're going to talk about weird, odd, critical signs and symptoms of vitamin B12 deficiency, which you can't ignore because vitamin B12 is essential for several functions of our body, including the production of our genetic material, our DNA, and the production of blood cells. But our body is not able to produce it, and for this reason, we need to get it from our food. Animal products such as eggs, meat, liver, chicken, fish, or in some cases, vitamin B12 supplementation is necessary. Pen and paper because our 10th symptom of vitamin B12 deficiency is tingling and needling sensations in the hands and feet. This is because vitamin B12 plays a crucial role in the functions of the nervous system because it mainly helps in the production of myelin. What is myelin? Myelin is a substance that covers the nerves and directly participates in the transmission of nerve signals or nerve impulses and consequently of sensations as well. So, if I pick up, for example, a wallet, this sensation of touch, this nerve impulse of touch is being picked up. I make the connection to it here in my hand, and it sends the impulse back to the brain for me to interpret this nerve impulse. And in these nerves through which the impulses run, they are covered by myelin. That's the importance of this substance. And vitamin B12 deficiency impairs the conduction of nerve impulses and also damages the nerves. So when you have a tingling, pins and needles sensation in your hands and feet, it may indicate a problem with your peripheral nerves. Even those with diabetes can have diabetic neuropathy, which can also cause tingling and pins and needles in the hands and feet. Our 9th symptom is fatigue and tiredness, because if your body doesn't have the ideal amount of vitamin B12, you're going to feel tired. So if you sleep well, 7 to 8 hours, but still wake up tired, this could very well be a vitamin B12 deficiency. And more than that, this deficiency can also cause problems with your concentration, your cognitive ability, and your memory, as we'll see shortly. So this happens because your body's cells don't function well without vitamin B. And importantly, in relation to tiredness, vitamin B12 is essential for your blood cells, the erythrocytes or red blood cells, to be healthy. So when we have a vitamin B12 deficiency, it can cause a specific type of anemia. And anemia, generally speaking, will prevent oxygen and the necessary nutrients from reaching your tissues and cells. In that way, you'll become tired. And what kind of anemia is this that is directly related to vitamin B12 deficiency? It's an anemia that we call megaloblastic anemia. In this anemia, the red blood cells, the erythrocytes, the blood cells, they are released prematurely, before the ideal time, before they complete their development, and with a size far above the normal size. That's why the name is megaloblastic, because there's a big red blood cell there. So look, if you have vitamin B12 deficiency and you start treating it, your energy levels are going to improve a lot, folks. So tiredness, as well as changes in gait, loss of vision, as we will see in a little while as well, is our 9th symptom of vitamin B12 deficiency. And the 8th symptom, which is actually not quite a symptom, it's already a complete syndrome, a disease, is depression. Vitamin B12 deficiency is one of the possible causes of depression. So, if a patient comes in with symptoms that make us suspect depression, it's crucial that we test their vitamin B12 levels, because this depression could be due to a deficiency in this nutrient. In childhood and adolescence, B12 plays a vital role in brain and cognitive development. Studies suggest that if a child has a B12 deficiency early in life, they are at a greater risk of depression in adulthood. So folks, depression can also be caused by a B12 deficiency. That's why we always need to investigate. The 7th sign is yellowish skin, technically referred to as jaundice. It can also cause the white part of the eyes, the sclera, to turn yellow. It can make the base of the tongue yellow. This is because a B12 deficiency can lead to the destruction of immature blood cells in your bone marrow. And this ends up generating high levels of a substance called bilirubin, which will end up depositing underneath your skin and will give your skin its yellow color. Generally, jaundice is a problem closely associated with liver disease. But when there is a condition that causes the destruction of red blood cells, jaundice is also a possible finding. Our 6th symptom is blurry vision. Vitamin B12 deficiency can damage nerves. And one of the most important nerves to us is the optic nerve, which is directly related to vision. So if we have an optic nerve injury, we can end up with a vision problem. The 5th symptom is muscle weakness, and that's because of anemia. Vitamin B12 deficiency will cause megaloblastic anemia. Megaloblastic anemia doesn't allow the blood, nutrients, and oxygen to reach the body. Your muscles will become weak. 4th sign, movement problems or gait changes. Why? Nerve damage can impair a type of sense that we have, which we call proprioception. What is proprioception? It's the ability of the human being to recognize the spatial location of the body, position and orientation, the force exerted by the muscles and the position of each part of the body in relation to the others, without necessarily using vision. I'll give you an example. For example, I have my eyes closed and I'm going to lift my thumb. I know my thumb isn't up. If someone picks up and lowers my thumb, even though I don't see where my thumb is, I know it's down. In the same way, I know where my feet are, I know where my right arm is, even if I'm not seeing. And this we call proprioception. A lack of vitamin B12 can end up impairing your proprioception. More than that, if you have anemia, if you're experiencing muscle weakness, if you're fatigued, that numbness, that weakness can also prevent you from being able to support your own body weight, affecting your gait, affecting your walk, and also potentially affecting your reflexes. The third symptom is headache, which here is one of the most common symptoms, if not the most common symptom of vitamin B12 deficiency in both adults and children. Some studies have even shown, for example, that half of the women who complain of headaches had migraine-type headaches. So half of the women who complained of migraine-type headaches had lower levels of B12 compared to the women who didn't have complaints of that kind. So if you have headache, if you have migraines, this can also be an indicator of vitamin B12 deficiency, that it's interesting to get the dosage. The second sign is a heart attack, the infamous racing heart, which is a result of the anemia itself. When we have anemia, one of the consequences is precisely an increased heart rate. Your heart starts to beat faster and more times per minute as a strategy to compensate for a lack of blood, because that's exactly what happens in anemia. You have less blood than is ideal, so you need to pump that blood faster because there's a smaller amount of it. First symptom, which is also very important, vitamin B12 deficiency is one of the reversible causes of dementia. So when we see a patient who is also complaining about memory loss, who is moving slower, who can no longer perform the activities they were once capable of, when they start forgetting a lot of things, when they start getting confused, are not understanding as well, we also have to investigate vitamin B12 deficiency. So one of the reversible causes of dementia is precisely this deficiency. So like I talked about depression, when the patient presents with depressive signs and symptoms, we must investigate vitamin B12. When the patient shows signs and symptoms of dementia syndrome, we are obliged to investigate vitamin B12 levels, all right? So long periods of vitamin B12 deficiency can cause memory loss, disorientation, dementia. So guys, if you know someone going through this, they need to get tested for vitamin B12, all right? A few warnings here, okay? Firstly, if you are vegetarian or vegan, if you don't consume animal products, you absolutely need to supplement vitamin B. Why? Very few plant-based products contain vitamin B12, only those that are fortified with vitamin B. So folks, if you follow a vegan or vegetarian diet, or if you don't eat animal protein frequently, you need to supplement, because the probability of you being deficient in vitamin B12, if you don't consume these foods, is enormous. I've already seen a patient who has a vegetarian diet, and then he already had megaloblastic anemia. He was feeling tired, weak. We asked for his blood test. What was there? The size of the red blood cell, enormous. Vitamin B12, low. We did the replacement and resolved the problem without any major obstacles, okay? Another warning, some diseases, some conditions worsen the absorption of vitamin B. For example, people who have an inflammatory bowel disease, such as Crohn's disease and ulcerative colitis, anyone who has ever had any surgery on the digestive system, such as bariatric surgery, and also those who use proton pump inhibitors, for example, omeprazole, pantoprazole, lansoprazole, exomeprazole. These people have a higher risk of vitamin B12 deficiency, okay? So I know a lot of people here take omeprazole, so be careful because you're at the highest risk of this problem. The ideal daily dose of vitamin B12 is 2.4 micrograms. And here I brought some foods and the amount of vitamin B12 that's in each of them to give you an idea. So, for example, beef liver is one of the richest foods in vitamin B12 that we have access to. So in 100 grams of beef liver, it has 70 micrograms of vitamin B, a much higher dose than the dose you need. Ground beef, 2.4 micrograms per 100 grams. It has the ideal daily dose. Egg, 100 grams of egg has 0.5 micrograms of vitamin B. Milk, yogurt, salmon, chicken, proteins, animals in general are your sources of vitamin B, or you'll need to supplement. Even if you are deficient, you'll be able to do oral supplementation with a capsule, a tablet, or intramuscular injectable. Okay. Look, if you don't know your vitamin B12 levels, if you have any of these signs and symptoms, this could be a vitamin B12 deficiency. And to diagnose this issue, you need to take a blood test. If your doctor doesn't order it, if you don't want to schedule a test with anyone, if your insurance is annoying when it comes to scheduling an appointment and there's only availability 5 months from now, this is no longer an excuse for you not to take the test. You know why? Here, for our channel, exclusive to our subscribers, we have a medical assistance program with no time restrictions. So, 24 hours a day, you can request tests, evaluate your tests after they are ready, renew prescriptions, clear up any queries, as well as small consultations. For example, if you have a cold, if you have diarrhea, if you have a urinary tract infection, our team will be available to assist you. This program was created by me and a team trained by me. So they follow the same protocol that I would, all right? So look, it's for prescription renewal, exam request, exam analysis, medical certificate, diagnosis, and treatment of issues that aren't so serious, identification of emergencies. All of this without a line, without needing to take a car, without having to wait hours at the urgent care unit or the family clinic. No, all of this at your fingertips on your cell phone, without stress, without having to run to catch the bus, to catch an Uber. No, you don't have to do that. And the first month, folks, is free. You don't have to pay anything. All right, so it's 30 days free for you to try it out, test it out, and if you like it, continue. If you want to carry on, it costs only $19.90 per month. And the services are what I've mentioned. If you want to make an appointment with any doctor of any kind, we have our doctors too. And an extra fee will have to be paid, but it's still a popular amount for a consultation, which will not exceed $100. For instance, for you to make an appointment with a psychologist, a nutritionist, a dermatologist, a pulmonologist, a general practitioner, or other specialties as well. So look, if you like this, if you want to take your vitamin B12 test, if you want to try this subscription service that I created specifically for you, that watch me here on the channel, click now on the first link in the description or the link that's pinned in the comments. Make your subscription. The first month is free and you can cancel whenever you want. So there's no commitment, okay? Guys, this live is over. But your journey, your time here on the channel is not over yet because I have separated 2 videos especially for you. So when this video ends, which is going to be in a little while, you're going to keep watching one of these 2 that I separated for you, okay? Look, thank you very much for your time. Thank you very much for your attention. And now keep watching this video here about juices that can help with your circulation, and this one about signs and symptoms that indicate problems in your child. A big kiss to you and your family. Bye-bye. I'll be back tomorrow. I'm out.